A very good evening to all the audience who are especially watching this Facebook Live by Autism Connect. And I always am grateful to Autism Connect for giving me this opportunity to create awareness among parents about the different aspects of autism, right from early childhood up to older ages. And it's always been great to be a part of this team. So today's topic, as I'm sure a lot of you all must have gone through the posters today, and the topic is quite a different uh, arena which has not consistently been explored by medical professionals as well as even parents for that matter. And the reason for the same is that we've always talked about sensory processing. However, we have not really interacted and understood the interplay of sensory processing with auditory learning. So, the definition of the interaction has been studied. However, the documentation has not been consistently evident because of difficulties with identifying the auditory learning apparatus in young children. And that's the topic for today. So when we talk about the interplay between the various sensory systems, which are very important in sensory processing, that is the touch sensation, the vision, the smell, the hearing, the taste, movement, which is all of us are aware of it, which is vestibular, and of course proprioception, that is a joint sense. Since times immemorial, we've all definitely agreed on the fact that the areas of tactile, visual, vestibular have been worked a lot. So they're the numero uno kind of systems, who have always been at the peak of learning and focus in terms of therapy. And I'm sure a lot of therapists and parents will agree with that. However, the area of olfactory, that is smell, auditory. So auditory is of utmost importance to speech language pathologists, which is very, very essential for them because that's where the real show starts. And it is the job of the occupational therapist to ensure that there is integration and synchronization between the auditory and the other systems. So why are the olfactory, the gustatory systems, and the proprioceptive systems so important for auditory learning? Because that's how they're connected. The vestibular and the proprioceptive system work hand in hand to identify how comfortably will a child adjust to his or her own environment. That's extremely essential. The sense of taste and smell is very important because even a whiff of a smell can distract a child very easily. So they need balanced sensory systems when it comes to smell. With taste, a lot of children are not comfortable with, and especially children on the spectrum will have difficulty with eating tangy citrus foods such as fruits. There isn't really a lot of research which says how effectively can we integrate these systems because we need a protocol. However, it is very difficult to create a protocol, which suits one for all. It's really difficult because every child on the spectrum is a different individual in terms of the kind of presentation of difficulties what they have, and it is very crucial that we do not have a one protocol for all kinds. Why is a proprioceptive system important for listening? That is the auditory apparatus. If a child cannot balance himself, now what is the difference between proprioception and vestibular? Many times they go hand in hand. To be able to explain everyone in simple words, proprioception is the feedback which you get from your joints. Especially the big joints, the hips, the knees, the ankle, shoulder, elbow, wrist. And these are important. Children cannot take weight of their own body. And that has got nothing to do with children who are extremely on the leaner weight scale, weighing scale, or on the middle of the weighing scale. The aim is that they should be able to identify how they can move their body in space. And that is why, if the joint sense and body awareness is not adequate enough, children are going to move about in their seats. And we see that with a lot of children. However, if you see that with screen time, children sit at one place very nicely. And have you ever wondered why that happens? The reason for that is because the screens, especially when children are watching a specific module on the screen. So you need to identify whether it's an individual talking, like a human being, or it is a cartoon show which is on. Because the major impacting factor is what is called as the shutter speed. The faster the screen slides, the more visual feedback it is provided. So a lot of times children might forget listening because the visual apparatus is so strong. And that is why they sit at one place. They don't need to move because the body simply is frozen because they have to focus on that object. However, the auditory system is a system which is left all by itself. So when it comes to the understanding of the sensory systems, which is the commonest approach which is used, is the bottoms up approach of processing, where the focus is, of course, on the primitive reflexes, which are the sensory patterns, and you move on to the sensory motor patterns, which is much integrated reflexes with differentiation of both sides of the body, the understanding of your own body parts, and then moving on to higher levels of understanding, such as perception, attention, which finally culminate into independence in daily living, cognition, behavior, and academic skills. So when you talk about learning systems, you of course know there are visual, there are auditory, and there are kinesthetic, the commonest ones. A lot of children are kinesthetic these days. They prefer by moving, touching, and doing because the visual and auditory apparatus is not strong enough. It is imperative that the government should formulate protocols. Although the health commission mandates, or the education policy also mandates that even at pre-primary, or for that matter, even at the level of 1 year and so on, children need to be screened for vision and hearing. My child can hear. We are not doctors to identify whether my child can hear or not. You need to go for an audiometric evaluation and a visual evaluation to identify whether your child can hear and see properly. Many a times we see that children might be extremely restless and they have a number, so they cannot see. If a child cannot see appropriately, how do you expect the child to move about in the environment? It's very, very difficult for them to do so. If a child cannot hear properly, so hearing loss many a times might be missed if it is mild. Moderate to severe hearing loss generally does not get missed, especially because children have delayed speech language development. A lot of times, because children are not very good visual or auditory learners, they move on to kinesthetic, that is touching everything. They need to be shown rather than being told. And these are children, who will be very comfortable as a part of a group because they're going to look at somebody else and copy. However, if that person is going to make an error, this child is also going to make the same error because there is no planning ability which is involved in the whole process. So, as a parent, you need to identify what is the learning style of your child. Spend an extra duration of time every day to identify. So, we all are aware of what is called as the memory, but however, this is a memory which is beyond the conventional memory strategies. So, we have something called as haptic. Haptic means any sensory pathway which involves the use of touch. So you can feel and remember what touching a dog's fur or a rabbit's fur or a rough piece of cloth feels like. Echoic. Remembering a same pattern of musical notes. Iconic. Pictures or images which have symbols. So for example, crossing the road. You cannot cross the road, or there is a U-turn. Those are memory images. So a lot of times memory is in the form of pictures. When children are learning, for example, sight words, you can have a child who's as young as 11 months also who can pick up sight reading. Because for that child, it is an image. So the same way, any kind of a picture becomes a memory. So sensory memory development is vital for learning. And as educationists or therapists or parents, it's very important and imperative that we need to harp on this and identify how easily can children learn rather than imposing styles of learning. So a lot of times I see parents trying to stimulate speech in terms of say ball, say bat, and the child is going to repeat what we have just said. Say ball, say bat. So simple changes which can be done is bot, bat, ball, give bat, give ball. Try to keep it simple so that the memory of the sequence of words remains and is built up. It gradually starts. So when occupational therapists work in close conjunction with speech language pathologists, this is a very primary area which they need to work on. Both need to be aware of how important it is that group work can make a lot of changes in children's learning. Also, children need to have a memory of taste and smell. That's very, very essential because that helps with the level of attention as well. Now, when we talk about auditory learning impact because of sensory processing, we also need to understand the simple process of auditory learning. That is, there is a sound which we receive through our ears. The whole process goes from the sound traveling from the sensory organs inside our ears, and then the brain will be interpreting the sound. However, the intensity of the sound matters. A lot of children will respond to a louder noise. Gia, please come, as opposed to Gia, please come. And children are actually used to some louder sounds or louder frequency, louder pitched sound, or specific individuals. Like, for example, a child responds better to the father as compared to the mother, or vice versa, or grandparents, or so on, or caretakers. Some sounds can also create a pre-identified response. No. So no is a very common word. For them, it is a sound, which is actually a word, but no is a sound for them. So it creates a negative impact. They know it that you have to, not do something. However, that no has technically zero meaning. So a song which a child likes, for example, a child who's extremely restless and irritated or crying and emotionally having dysregulation may like Baby Shark, and the whole ambience of the environment changes. So this kind of auditory information can either calm you down, or a child who's sleeping and the moment you say chocolate and they're going to wake up because that's how they're tuned in. So following instructions and not purely understanding but executing them is also very, very important for children. And that is why we always talk about the auditory apparatus, which needs more extensive research as to how children process information. So a lot of times children love to sing, a lot of children on the spectrum love to keep on humming. And I have a lot of parents also who keep on asking, ma'am, it's very difficult. They constantly keep on mumbling something. I said, of course, they are going to, because that's how they're regulating themselves. Well, they need to identify as parents that when does this happen? It primarily happens when children find it difficult to perform a task. They need to identify their zone of comfort. So I have a child who keeps on mumbling some kind of songs, even when she's on the swing or when she's sitting and doing an activity. However, the difference is that on the swing, the moment the swing will move with a greater speed, the mumbling stops. Because the vestibular apparatus and the proprioceptive feedback given is much different. So, well, yes, suspended equipments do make a major change. However, at home, not all the parents can do so. So, they need to create activities which involve use of combination of two sensory systems. For example, a child likes to listen to a nursery rhyme. So, the parent could actually go in and start with Little Miss Muffet. This is a song which the child likes. Sat on a. So the child has to remember what was the next word. Creating a sequence with songs of the next word really helps children to build up on auditory memory. Let the child listen to a specific word. So we are looking at the auditory system, especially auditory learning, through only the auditory apparatus. Now, when I'm going to tell the child table, scissor, fan, can you show me these objects in the room? In the same order. So now the child is going to do table, scissor, fan, and yes, the sequence has been understood because that is how they're going to remember. And why is this so important? It is not just for any child. Sight reading does help a lot of children. However, not all children will know the spelling also. So if I have to make the child work on his or her spellings, I need to know the concept of sequencing, which means the word table is Table. That is the order of the letters. It cannot be Tabel. Rhythm is a very important component of auditory learning. Any kind of a rhythm. So when you use a tap method, la, 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 and the child is going to do along with you. So you're giving a cue which is purely auditory. Yes, of course, there's a kinesthetic component, but you're not using a visual aspect. The child cannot read la 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 on the screen. So auditory learning has to be primarily done with the auditory apparatus only. You cannot have pictures being shown and say, give me ball, fan, and scissors. So the child is anyways knowing this is ball, this is fan, this is scissor. However, if I do the other way around, can you show me where is the ball, fan, scissor? The child has to remember the word and then identify. So if you want the auditory learning of your child to improve, use the auditory apparatus first and then move to the visual apparatus. You can also use another system. For example, children who like to read a lot. So can you show me the word? A lot of children on the spectrum are good readers. So show me the word chip, cookie, diamond. Compound words are very they're good, they're absolutely a good hit with children, because I always feel chocolate chips, bread butter. So the natural pairs which are used by a lot of speech language pathologists really help children to build up the concept of association. That's very important. And using the child's strength. So identify what the child likes to listen to. Some children might like listening to nursery rhymes. Some would love white noise. Some would enjoy movie songs. And I really encourage any kind of listening ideology which parents would like to propagate. That's very, very important for children to remember. The auditory environment has to be as much as possible controlled initially when children are in the learning phase. Then you can use a distractor. So that is why we recommend to parents that use your voice rather than using a device. So, Tara, give me the spoon, or Tara, give spoon. So keep the spoon and maybe a glass. So at least you giving a choice. So you know very well that Tara will pick up the spoon and not the glass. So start with a simple learning environment and then move on to a complex environment. So what are the characteristics of a auditory learner? They're really going to listen. You're going to tell them a story, or you are going to ask them something and they start. The train just begins with. However, with the auditory system, we need to remember that it is very easy to go tangential because you do not have a standby support. In the visual apparatus, you have something which you can see, but in the auditory, you have to remember the sequence. Like, for example, if you're learning a song or a poem, which is about 10 to 15 lines, you need to remember that sequence. So, sequencing is an integral component of learning, especially with the auditory system. So, a lot of children who will keep on talking and talking and talking, and they finally do not know where they were or what they were speaking about because they have no idea where they started. So, it's good to put down a keyword list. So we advise parents that give 5 words: time, pencil, ball, napkin, book, and let them create a story, or let's weave a story, or let's talk about these things. What are they used for, and so on. So it's very essential that the therapist and the parents need to identify how to cash on the learning strategies of the child to improve their instruction following ability and the listening ability, because listening is a very complex process. The child needs to first register the information. So many a times, if you see that a child who's actually paying attention is going to say, if I'm going to tell the child, give me scissor, napkin. So the child is again going to go back to the activity, give scissor, napkin. So they're going to use it as an internal cue. So internal cues are very important for children. So now I know that the child is going to give me exactly those two things because the child has self-reiterated, that I have to get these two things. So that is where you have won the battle. That the child could say so. Many a times children just keep on learning. So the difficulty with the auditory apparatus, they can learn really fast. They might know a song which has about 20 lines, but the meaning is not understood. So what does the song mean? They don't know. So that is another big struggle which we face with children, because to explain to them what it means is also difficult. Like, for example, shlok. So any kind of a mantra, if you're going to teach them, looking at complex languages is not really the need of the hour. With auditory learners, it is highly recommended that begin with just one language and then move on to 2 languages. As a speech language pathologist and occupational therapist, we always recommend using the same language for both the therapy sessions because that creates a uniformity in learning. Mother tongue, of course, is welcome, but for a child on the spectrum, it is again a challenge because if you're looking at 2 languages, then the parents would be really very enthusiastic about it. But let me tell you one thing: give water, pani do. So there are 4 words. So we're not looking at just 2 words because it means the same in Hindi and English. So that is something which parents need to remember. That if you're going to look at a language and use 2 things, it's not going to work with the child on the spectrum. You need a structure which can move to an unstructured situation gradually. Take frequent breaks in the auditory process because the auditory apparatus is the one which will easily get fatigued. And the moment children fatigue, they're going to start squirming. They're going to start yawning. That is what I see with most of the children. Offer them a glass of water. Hydration is the most essential component of sensory processing, which a lot of parents miss out. And especially in today's times, because children are dehydrated and not adequately packed with nutrition. That is why there are multiple factors which are going to affect the processing. Now, as a parent, you'll wonder why. Children need to eat with their own hands. They need to understand how it feels, how the food feels. Eating a pizza is different from eating dal chawal. Eating fish is different from tearing a chapati. Eating a watermelon is different from eating a banana. The textures change. Self-feeding is very important in children, not just children on the spectrum, but children of all ages. You need to have coordination with the body and the oral apparatus. That is where they can feel the textures within the mouth. So once that integration happens, it is going to improve the muscle tone of the muscles of the mouth, the lips, and the facial apparatus. And why are these things important? So if the strength of the oral muscles is not good, how do you expect children to use syllables and sounds and letters and words and sentences and so on? So children need to chew well. They have to chew, and for that they need to be given graded textures. They cannot have simply soft or mashed foods. That is absolutely not advisable. A word of caution for all the parents, especially the ones who have younger children. It is highly recommended that bottle feeding should stop after the age of 1 year. And I always make it a point because we see a lot of older children also being bottle fed. And many a times, because they cannot chew, they do not get a good sensory feedback around their mouth. And that is going to affect the listening, because the coordination of the oral structures creates so much of discomfort that most of the times the children are restless and they're very irritated and very angry. They can't chew, so they chew onto non-food items. If they cannot regulate themselves, so you must be wondering, how is it related? These are like completely unrelated things. But if they cannot chew, they will need something to chew, which is not a food item, because that does not disintegrate. That is a non-food object, which I mean, like a teether or a plastic or a rubber rubber band, or it could be a toy, and that is going to cause distractibility. If the child is orally distracted, how do you expect the child to listen to what is being told? And that is where learning gets compromised. So everything finally boils down to the auditory apparatus. There are difficulties which we see. Most of the times, the research has primarily pointed to what is called as a central auditory processing disorder, CAPD. So you have the nerve affectation. Many times there will be a nerve affectation which can actually lead to a hearing loss. Also, there can be a difficulty processing information. So this component, if you see, which is the processing, is what cannot be always tested. You can, based on a questionnaire. Those are self-limiting questionnaires. They're not exhaustive. And when there is a disorder, so how do you identify the difficulties in young children? Older children, it is still easy. However, the whole apparatus being affected is a different scenario. But when only a part of it is affected, that is a processing phenomena, then how do you test? Which component are you going to look at? So just the way we have visual closure, visual of constancy, the same way there is auditory closure. Now, if I have to give you an example, it will be black is the word. Black. And what would come next? So the child might say blank, black. That they should be able to identify. But those are auditory perception tasks for older children. Auditory constancy, auditory discrimination, baba, mama. Those are something which are easy. So it is a skilled professional can only get the responses which are needed from children. The main aim of the therapist is to ensure that there is a harmonious working of the skill. So why does the OT and the speech language pathologist need to work hand in hand? Because if we cannot get the child to be proprioceptive in either integrating himself in the proprioceptive, vestibular, gustatory, olfactory, visual, and tactile, then the auditory learning is going to be significantly affected. Using musical instruments, a lot of times, what strategies do we use for the auditory learner? Let them listen to audios. Have you ever recorded your child's voice and made them listen to it and ask them to tell you what they were talking? It's such an amazing and a simple game for any child to learn. And it is super fun. Let us listen to some names. Always remember to use a pure auditory form of learning. Mama went to the garden. Where did Mama go? So asking questions, coming to that aspect. The lesser number of questions asked, the more easier children understand. So how do you reframe the sentence? Mama went to the garden. Now you want the child to answer. Mama went to the... So the moment a question is asked, children feel a bit of a threatening scenario. What if I'm wrong? Watching videos with the volume being muted, the sound being muted, or the volume being very less, and ask them which song is being played. They need to look at the picture. So children like such newer games. You have used the screen, but in a different manner. So I used to do it with a lot of children where only the song would play, and they would be so much focused because they wanted to know from where the sound was coming. So try using alarm clocks, try using toys which make sound so that the children can pick up the source of sound. That's very important. And children who like to read, you could actually ask them to read out to you in between and then tell what they have read. So what are the tips which we normally identify for children who are having difficulty? Sit at a place where they can hear appropriately. You can't be very far off from them. As I already mentioned, screening is very important for the hearing. Now, flashcards will be used, but at the same time, use flashcards in dual form. So you have some cards which have only pictures and some cards which have only words. Initially, we prefer using the ones with pictures and then with words, and then pictures and words together. Spelling strategies are the focus of a special educator as well as a teacher. So that is beyond the scope of today's session. So the key takeaway from the whole live is that they need to just hear things and not see things in order to remember them well. And that is where I firmly believe that as therapists and parents, we need to work on those additional strategies. I'm trying my level best to get a pure auditory form of learning rather than using, we normally use a visual and auditory format, which I feel fails because once you remove the visual stimulus, auditory is wondering, oh my God, where am I? Because that is a system which is very strong at one point, but at the same time, it is left in the lurch because it is not supported always. So make it a point for children that, they have to enjoy, to be interested in listening to you, like making a sound, like animal sound. Children love animal sounds. Begin with something what they like. A sound which is really having a lot of funny intonation, talking to them in a different tone, and that really gets their attention. Once the auditory attention is, harped on, learning becomes much more easier for the auditory apparatus, and it's very, very essential. So rhythm, using rhythmic movements. So during the lockdown, we used a lot of song-based learning to develop the level of attention. And the song would be played without the video. And that is why children would struggle because they had to listen to the song, do the actions based on the actions which were told. For example, it is put your right hand up, stuff, especially when you're in a group. So use songs which are paced enough so that they can go gradually, increasing the intensity, but that really helps children to build up on their level of attention. So the takeaway from today's session is that as much as possible, parents do focus more on the listening and the auditory apparatus channelization of children rather than working on the other components. Children need to be regulated, and for emotional regulation, it's very essential that they need to understand what you told them. Frequent repetitions have no meaning because that's going to invariably affect the classroom environment. So one-on-one sessions are beneficial for children, but in a school setup, they're going to take group instructions. So for them to be able to perform independently in a group, they should be able to perform independently one-on-one at home, in the therapy session, in the remedial school sessions, and then move on to a larger environment, because we firmly believe that every child has a right to be at school, every child has a right to play, and for all these things, you need to hear well. So with this, I am really very thankful for Autism Connect to organize this live, and the forum now is open for questions. So do post your questions if you would like to post. You can also send your questions to Autism Connect and we can take them later as well. But if anyone would like the questions to be answered right away, we can do that. So there's a question about chiropractic services which help in sensory regulation. I am extremely uh, sorry about this because I'm not really aware of the nature of chiropractic services. So I'm not really in a position to be answering this question. You will actually have to ask a chiropractic um, individual professional who does. I really don't work with chiropractitioners. So I am really not able to answer this question. My apologies for the same. Just waiting in for more questions. So any more questions could be directly sent to Autism Connect. And thank you all who have joined. And do definitely watch the Facebook live session, which will be sent as a recording on the Facebook uh, Autism Connect page. And do provide your feedback. In case of any queries, do message on the same. Thank you so much for watching the video. Have a great evening.